The birth of a new baby, much less twins, should be one of the happiest times for a mother and family.
But one woman says that happy time turned into a near nightmare. Amanda Roberts explains.
In a letter, you can put into words what you feel in your heart.
I love you so much. So much has happened since my last email.
For Beth Wood, she wrote letters and emails to her 3 little girls just after learning her heart had stopped working.
I gave birth to your beautiful sisters and went into heart failure, a condition known as peripartum cardiomyopathy.
Wood found out she was pregnant with twins September 2017. Things seemed fine until the last trimester of her pregnancy.
I was gaining a lot of weight. I would gain 10 pounds a week, 20 pounds a week, 30 pounds a week.
Despite the dramatic weight gain, swelling, and loss of energy, Wood gave birth to 2 healthy girls, Marley and Milani. While in the hospital, she kept insisting something was wrong.
I could barely hold them without falling asleep. When I was in the hospital, I dropped them a couple times.
Wood said doctors and nurses wrote her complaints off as common pregnancy and postpartum symptoms and sent her home.
I was really, really depressed. I felt isolated. I felt like a bad mother. I felt like I was crazy. Make them laugh, babe.
While this should have been a precious time to bond with her newborns, she struggled to care for them. She couldn't catch her breath, walking, sitting, lying down, nothing helped. She rushed herself to the emergency room.
And the doctor came in, she said, we have bad news. And I just kept saying, don't let me die, have babies, have babies.
At 33, doctors told her your heart's failing and readmitted Wood into the hospital. Her diagnosis, peripartum cardiomyopathy, or PPCM.
I would have died in my sleep at some point. I just knew something was wrong. And I was just gonna keep going back to every ER till a doctor listened to me.
Doctors didn't know if she'd make it back home to her family, so she wrote these letters.
Being admitted in the hospital away from you and my newborn babies was the hardest thing I ever had to endure. I wanted them to remember me, and I just honestly felt like I was going to die.
Dr. Dennis McNamara is the co-director of the Peripartum Cardiomyopathy Network. He says the biggest problem surrounding PPCM is the lack of awareness of the condition among medical providers.
No one expects a young woman in her 20s or 30s or 40s to be presenting with a heart condition at the time of what should be just a wonderful event, the birth of their child.
The condition impacts nearly 1 in 2,000 women who give birth every year. While it can be genetic, doctors say it can develop among any pregnant woman and tends to show up more in Black women.
The United States is one of the only developed countries where maternal mortality is actually increasing.
The tricky thing is the symptoms of PPCM mimic those of pregnancy and postpartum, and that's why women themselves are their best advocates. So if you start to experience excessive swelling, difficulty of breathing, shortness of breath, or heart palpitations, go to the doctor and ask about your heart specifically. McNamara says the test to confirm PPCM is relatively easy with a non-invasive cardio echo. And doctors say once it's diagnosed early, it's easier to treat.
We are getting better. People are picking up and are more aware of the illness. It's relatively easy to diagnose if you think of it. The important thing is to think of it.
Wood is home again with her family, but her life is different. She's working to strengthen her heart and regularly seeing a cardiologist and taking medication, but she says she still regrets not being there for the twins.
Oh, I basically missed out on the first 2 weeks of their life. I just feel like I had no bond with them. I was basically robbed from my newborn experience.
Hey, little diva.
That mom guilt, she says, is growing even stronger now that the twins' first birthday is coming up.
That's something I actually fear because it's gonna bring me back to what happened. My oldest, I love her birthday. I think about May, I get warm sensations, I get happy, but when I think about June, it's completely opposite. It's the worst month of the year for me.
Faced with death, Wood says she battles her fears every day.
Am I gonna have to explain to them, this is what almost happened because I was pregnant by you? I think about that too. I don't want them to feel responsible.
Help!
She's choosing instead to pour her love into her health and children instead of letters to remember her by.
I would give up my life if I had to. It would have been worth it. I wish my days would never end with you. I love taking care of you. I love being your mom. I love watching you grow. I love you.
In New Orleans, Amanda Roberts, Fox 8, Local First.
McNamara says there are women whose cases of PPCM are not caught early enough, which results in the mother dying or needing a transplant. But for those cases that are caught early, roughly 70% of those women's heart functions will return to normal.